Hello, everyone. Welcome to today's last session of the day. Really excited to be here. My name is Tina Costa. I'm one of the directors with the Office of Virtual Health. Continue to be your host for today's virtual sessions. And again, it's my pleasure to welcome or re-welcome you to the 2023 BC Digital Health Forum, inspired by Canada Health InfoWay's Digital Health Week. As our last session, we want to make sure that we're continuing in our collective gratitude for the opportunity to come together from many traditional, ancestral, and unceded territories of BC First Nations. May we all take another pause today to honor their connection to the land, their stewardship in caring for and nurturing these lands for all time. And let us again just give thanks for the incredible opportunity to come together, gather, learn, collaborate, and provide care on such beautiful lands. Now, I have the absolute pleasure of introducing our next presenters, Christy Boyce, and Cara Bethel. Christy, you may have seen her in a presentation this morning, but want to repeat her bio for those just joining. Christy is a critical care respiratory therapist and certified respiratory educator for over 17 years, working at BC Women's and Children's Hospital and throughout Fraser Health. Her experience ranges from working in neonatal, pediatric, and adult critical care populations to pulmonary diagnostics, respiratory education, and home care. As a leader with the Fraser Health Virtual Health Team, Christy develops the team's learning and education strategy and supports clinician learning, clinical practice resource development, virtual health foundational learning pathway development, virtual care evaluation, and patient in education redesign for virtual delivery. Cara is a virtual health learning consultant at Fraser Health, where she utilizes evidence-informed practice and education theory to develop educational programs for providers and patients. Using evidence-based, pedagogically informed approaches, she and her team implemented role-specific, self-paced e-learning competency curricula available online anytime for learners to complete. The result is a more flexible, accessible, less resource-intense competency assessment that decreases the time from training to providing patient care. Cara holds a Bachelor of Science in Kinesiology, Masters of Education in Health Education and Active Living, and a certificate from the University Teaching and Learning from SFU. Please join me in welcoming Christy and Cara for their talk on Are You Ready for It? Lessons learned in supporting virtual care education for a new remote patient monitoring service. Cara and Christy.
Thanks, Tina. Just as Cara pulls up the slides, if you are wondering, is that a Taylor Swift reference? It sure is. We have young ladies in our house and we're big fans. Okay, great. Okay, so hello, everyone. My name is Christy Boyce. I'm a leader at on the virtual health team at Fraser Health. And Cara.
Yeah, I'm Cara Bethel, a learning consultant with the virtual health team.
So a little background context before we begin. Our little virtual health education team supports patient and provider education across Fraser Health service areas. We help patients and providers to engage in quality and safe virtual care. We also support our virtual health program operations education needs as best we can without being subject matter experts. The presentation we're sharing with you today is called Are You Ready for It? Lessons learned in supporting virtual care education for a new remote patient monitoring service. So we're going to be using that acronym RPM throughout the presentation. It's important to note that the experiences and learnings we're sharing today are from our lens as an education consultation service. The other lessons learned by the clinical project team and by heart failure remote patient monitoring operations are not shared here today. We'd first like to take a moment to acknowledge that Fraser Health provides care and services on the traditional, ancestral, unceded or stolen territories of the Coast Salish and the Inuktitut Nations. Our service areas are also home to 6 Métis chartered communities. So today we will be highlighting our experiences in supporting the launch of a new remote patient monitoring service, specifically speaking to supporting education and learning for the providers and future patients. Learnings that we share will include how we use the concepts of change management to support the service adoption for both patients and providers, how we use patient feedback and journey maps to design and develop general, accessible, and evidence-based patient resources, and the approach we use to create foundational learning pathways for staff providing care in virtual first or virtual only programs. And finally, we will make recommendations that will inform education and learning support approaches for future RPM and virtual care services. For a little bit of background for you, this virtual health operational service, our virtual health team collaborated with the Fraser Health Heart Function Clinics to develop an RPM program for heart failure patients. This service has 5 monitoring clinicians who are registered nurses, and they use the TELUS Tunstall solution as a digital tool and RPM platform. They went live in April of 2023. Over to you, Cara.
Thank you, Christy. So let's start with discussing how our ProSci ADCAR trained education team, so Christy and myself, focused on the use of change management to understand clinician and patient readiness and to support adoption and sustainment of this new virtual service and tech use in the patient and provider context. In the design and development of patient resources, as well as the learning pathway for providers, we used a change management lens. We specifically focused on the awareness, desire, and knowledge components of the ADCAR change management model. So for awareness, the what is it? We created marketing and promotional type materials to promote awareness of the RPM service for both patient and providers. For desire, the what's in it for me, we developed resources that highlighted the benefits of the program to providers and patients. And finally, for knowledge, that how does it work? We created some how-to guides and videos explaining how the program works. We made sure to follow a sequential flow of the ADCAR change management model, as it's important to support the awareness of and desire for the change before we try to provide any necessary education or any on any new technologies, workflow processes, or new service approaches. So now I'll speak specifically to the patient resources we designed and developed for this new RPM service. One of the first steps we took before getting to the design stage was using the feedback from existing RPM patients in the form of patient journey maps. So we as an education team supported other members of the virtual health team to conduct 9 interviews of patients who had taken part in one of Fraser Health's 4 remote patient monitoring programs within the past few months to a year. We then created 4 respective patient journey maps that reflect the patient's perspective of the program process, their thoughts, their feelings, and considerations. So this is just one example of a map. And as you can see, we map out their journey from the time they're either admitted to a hospital or maybe speak with their healthcare provider in a clinic, to then having the referral made, and then they go home, they're enrolled in the program, their experience of their day-to-day routine, and finally when they're discharged. So out of the 4 patient journey maps, there were many themes and recommendations that emerged. The ones that really helped us inform us as an education team what to create in terms of patient resources included this lack of awareness, the inconsistent information, and the varied learning needs. Based on these themes, as well as evidence from our research and evaluation team's work via multiple literature reviews, and using the change management components we discussed earlier, we designed and developed multiple resources for RPM patients, and I'm going to share those with you now. So we created 2 short informative cartoon videos that are hosted currently on our Fraser Health YouTube channel, and they're located on our RPM public facing website, which I'll talk about later. In one video, we have our nurse, Andy, here, and he talks about what remote patient monitoring is, highlighting the what's in it for me benefits of taking part in the program, and sharing some positive testimonials of patients who've participated in similar RPM programs. In the other video, our nurse, Andy, again, goes through how a remote patient monitoring program works, what kind of monitoring equipment the patient will be using in their home, and how to use the tablet. These videos were quite well received when we shared this on LinkedIn, and we got feedback that very few organizations were using short cartoon videos for public patient education on virtual care programs. The next resources was a patient handbook for heart failure RPM patients created by Christy and Dallas, one of our clinical leads who took on the role as a clinical nurse educator for the launch of the new heart failure RPM service. This handbook was reviewed by our patient education team for plain language and readability, is located on our Fraser Health public-facing patient catalog website, and provides general information about the program and who to contact for support. We also created this one-page infographic on how remote patient monitoring works and the benefits of it. This is meant to be a quick and easy resource that can be emailed or printed off in hard copy to provide general information about remote patient monitoring for a provider or patient. We include a QR code here at the bottom that people can scan to access our public-facing website, which has more information and hosts the videos that I just shared with you. And finally, we worked with our fabulous communications team to design an external website that has general information about remote patient monitoring and houses those YouTube videos that I talked about earlier. So for all the resources I just shared, we really tried our best to use a patient-centered approach when creating them, focusing on these resources being accessible, inclusive, and evidence-based. So in terms of accessibility, we asked for the communications team to create, it's called a tiny URL, so it's easy for someone to type out the website address. The videos are hosted on YouTube, which is a familiar and easy to find platform. And we tried to focus on general information about RPM versus specific to heart failure, so that the majority of our resources can be more accessible to patients in other RPM programs. In terms of inclusivity, we really tried our best to make them from a health literacy approach. For example, working with the patient education team to ensure everything was written in plain language. Our resources also have the option of being available in multiple languages. YouTube provides closed captioning on our videos. And within the videos, we made sure there was a diverse representation of characters. And as I mentioned before, we really make sure that all of our benefits that we highlight or any research we highlight in our resources are evidence-based. And a lot of that evidence comes right from the literature reviews conducted by our own evaluation and research team. And now back to Christy.
Thank you. We are so lucky to have that team. Please, if you have any questions about any of those resources, put them in the chat. We are always willing to share if you just want them. So finally, our third area of focus today is on provider training and education pathways. So for foundational virtual health education and training for our remote patient monitoring clinicians, we needed to focus on first, who our clinicians were and consider their scope of practice. Next, we ask ourselves what knowledge and skills they require to succeed in their work, whether it's related to their clinical information system, their use of video visits, their remote patient monitoring care pathways, or their processes. We needed to consider how we supported their confidence and self-efficacy, with some opportunities embedded to practice up front. We also needed to look at where their knowledge resources were placed so that they could access information online and with ease. We needed to consider how can we build competency-based education pathways in a fast-moving project with a short time to launch. So some of the categories for provider education will be listed here. To learn the basics of digital health literacy, we guide our learners to PHSA's Office of Virtual Health Digital Health Literacy e-learning course first. Then to understand virtual health care standards and policies, we have them review our Virtual Health Decision Support Tool, or DST for short. For virtual care and practice, we have our virtual health toolkit, other e-learning courses, our self-assessment competency tool for video visits specifically, and we also have a simulation guide for clinical teams so that they can learn how to practice video calls if they choose to do so. To understand and learn the technology tools for video visits, we guide them to learn about and practice using Microsoft Teams for clinical care. There are 3 other categories listed here that our project lead, our project clinical lead, Dallas Vardy, felt were really essential for clinician success. And those are orientation on the remote patient monitoring equipment, biometric devices, technology tools, everything that the patients will be using within their home. Knowing the equipment inside and out helps the clinicians to better support their patients. Next, self-management education. Given the chronic nature of heart failure and the continuous connections between patient and provider, Dallas was compelled to add some self-management training into the curriculum for the heart failure RPM monitoring clinicians. It was well received and is something to consider for other similar remote patient monitoring programs in future. Finally, Dallas focused on a lens of the patient-facing experience of RPM, helping the clinicians see the care service from their patient's viewpoint. In terms of hosted resources, This picture is showing you Cara developed a mini intranet SharePoint site for clinicians to easily navigate and find resources and information in the future. So this is their day-to-day information as well as education and training. So let's move on to our recommendations portion of the presentation. This is how we plan to move forward to support this type of learning and education work for future launches of virtual health services and remote patient monitoring services. First, I'll cover the recommendations for change management. So first, we use evidence from literature reviews that highlights positive patient outcomes of remote patient monitoring programs. This data can help drive awareness and desire to be involved in this type of program, whether you're a provider or a patient. Remember that you need to establish awareness and incite desire before you move on to trying to educate people. So this is where we focus on the why. Why would I want to be in this program as a patient? How will it help me now and in the future? How does the program meet my needs, my health goals, or support what matters to me? Next, make sure that you involve your change management leads, experts, consultants right at the beginning of the project. Waiting until you have poor adoption is not the right time. So often Cara and I will be brought in to begin education work, and we need to ask about how awareness and desire for the change was thoroughly supported. And it's frequent that we then have to take time to go back and strengthen marketing or communications before we can move along to the K in ADKAR, which stands for knowledge. And lastly, highlight patients' experiences in RPM programs using any qualitative data that you can get. Quotes and quips can be really impactful when they support a positive patient experience within a brand new virtual care service. Remote patient monitoring is still a relatively new way of caring, and people need to feel trust and see value in the service. Over to you, Cara.
Great. So some recommendations we have when it comes to designing and developing patient resources for a virtual care service include keeping those resources general and high level so they can be used for other similar or future virtual care services. For example, the videos that we created aren't specific to heart failure RPM services, so can be provided as resources to patients in other programs, existing or future. Consider where and how you'll be hosting the resources. A lot of us rely on our organization's intranet sites or other internal platforms, but when creating resources for patients, they won't be able to access those sites, so you need to consider other options. Partner with a patient education team or other experts in plain language and other health literacy approaches to ensure you're designing your resources from this way. Involve your patient partners or use patient feedback or journey maps to inform the design and development of your resources. Make sure that you build a maintenance plan, continually revising your resources based on patient and provider feedback. This is especially important with a new service design as things change quickly. And make sure that you consider your organization's branding standards if planning to host resources in public spaces. I learned the hard way that the color scheme, placement of logos, and certain language matter when it comes to aligning with your organization's branding standards.
Okay, thank you. So finally, I'll review our recommendations for provider, foundational training, and education pathways. So first, it's important to consider when you want to partner with professional practice in order to create competency-based education. For us, this was a very fast-paced project with short timelines that did not necessarily allow us to engage with our professional practice team in time to draft necessary components that were required before outlining the role-based competencies. So instead, we continue to do this work in future, guided by the operational program leads. Next, it's important to differentiate and clearly outline roles, responsibilities, and clarify expectations around which education support is doing what. What will your vendor trainer offer for support? What is the role of your clinical project leads in supporting the clinical application of technology? How about the role of your clinical subject matter experts, the educators? Finally, how can a learning design focused team support success overall? Consider managing expectations for providers on where their education and training information will be housed. With the rapid pace of service adaptations in a new virtual program, we try to support clinicians to transition to online resources as their single source of truth and information. SharePoint sites that are visual, easy to navigate, and have information chunked out are really good for this. Next, don't make assumptions about digital literacy and/or confidence. Train everyone from the basics and upwards. This approach helps to create foundational skills in virtual care that clinicians may not have yet received, and highlights opportunities to potentially create champions if some clinicians are advancing rather quickly. Next, include education on website manner and therapeutic relationships. The quality and outcomes of virtual care interactions depends highly on creating a positive patient experience, one where they feel connected and heard. All clinicians can benefit from review of website manner basics, as well as being reminded of the value of relationship as a therapeutic agent, even through a screen. It can be done. Next, ideally, you will have established a clinical nurse educator role or charge nurse to transition the learning and education resources over to optimally hired early on in the project planning process. And finally, keep the training pathways foundational, allowing for service-specific areas to build on that foundation at a later date. This way, the training can be used across numerous virtual care services as they launch. For example, the basics of virtual health in practice, using video visits, RPM care, text or chat messaging. Okay, last slide. So in summary, when our education team, when we're asked to support the launch of, or the next launch of a new remote patient monitoring service or virtual care service here at Fraser Health, we have some solid learnings to take forward to support project success. Elements of change management, building thoughtful patient resources, and creating clear provider learning pathways are going to be really helpful for us to move forward effectively and efficiently. Thank you.
Thank you, Christy and Cara, for really sharing a truly authentic process to not only understanding the educational needs for an RPM program, both participants and providers, but also that great process your teams developed to ensure both a patient-centered and a provider-centered approach. Really appreciate that. And you can see from what you've shared the benefits of co-developing those supportive resources and having all of those people involved in making a healthcare experience as positive and meaningful as possible. We do have one interesting question in the chat that I'll share with you guys. You mentioned it just slightly, but the question is, what role did the vendor have in supporting these education efforts?
Well, we knew that was coming out. I'm going to let Cara, do you feel confident taking that one? You were a little bit closer tied to it than I was.
Yeah, so I think that the vendor training was quite separate. What part of our team, so our project manager, project lead, and a coordinator worked with the TELUS solution and us to determine if there were any gaps. So we were able to work a little bit with the TELUS vendors to give some input on their manual that they already had created, just to take out things that were irrelevant for our particular program. So that was the only kind of touch point we had with them. But in general, the RPM monitoring kit with all the equipment came with that little manual that they had, and it wasn't specific to any program, it was very general. So they were open to our feedback and were able to cater a little bit to our program, but really it was all on them to kind of train people on how to use that.
Great, thank you for that. And just want to share a couple of the kudos that is in the chat. There was an earlier question that whether or not there was interest around developing these resources for other illnesses. And certainly you've spoken to that, so thank you. And then just a comment here around how any other team launching a remote patient monitoring program will certainly benefit from this content and the process and lessons learned that you have shared. And so looking forward to working with you on future RPM education.
Great. Lovely comments. Thank you.
Wonderful. Thank you both again. We will take this opportunity to end this particular session and want to make sure that we take a moment to bring up the poll once again to gather feedback specifically on this question itself. Your feedback is really important to us and really helps us plan for next year and for our presenters. And as you're completing that, I just want to take a moment to once again thank Cara and Christy for wrapping up this great first day of the 2023 BC Digital Health Forum. Today's presentations have truly demonstrated the many ways that our province is coming together to change and to improve healthcare for patients, families, and our healthcare providers, and how truly, we are collectively committed to achieving the strategic priorities of the BC Digital Health Strategy. So looping back to Shannon Melevek's opening remarks this morning. If you haven't had a chance to see that, please go back into FeedLoop to see it. And then just a general, real special thank you to all of our incredible speakers today and to the fantastic audience that has joined us virtually. There was at least 100 people on the line at any given time, but several more registered for different sessions that are of interest to them. We are looking forward to bringing you back or seeing you back again tomorrow, where you can join us for more virtual sessions. Tomorrow, we're starting a little bit earlier. We should have our stuff together and organized a bit more, but we're starting tomorrow at 10 a.m. Pacific time. We certainly encourage you to explore the event platform for more information about what's coming up tomorrow and for the rest of the week. Doing a quick shout out for the healthcare design thinking workshop that is coming up on Friday. If you happen to have an open agenda come Friday, please sign up. Or if you can shift your schedule around, we'd love to see you there. It's another in-person session. And last, but certainly not least, don't forget to check out FeedLoop for a chance to win some great prizes. Otherwise, once again, thank you to everybody for joining in today, for your comments, for your questions, for your interactivity, and enjoy a wonderful evening.